Welcome back to The Big Picture. I'm speaking with Erie County Health Commissioner, Dr. Gale Burstein. Now, if a vaccine is developed for the coronavirus and it comes out and a similar number of people get this vaccine every year, is this going to fade into our culture as just another version of the flu? Or is this going to continue to be something unusual that we're going to have to be extra careful of? I'm not quite sure how the future is going to unfold with this.
Yeah, you bring up a good point, because a lot of this is dependent on perceptions and culture. So if we are fortunate enough to have a COVID-19, an effective and safe COVID-19 vaccine developed and available in the community, we know initially, because we've all had the experience of either ourselves or knowing somebody who's been affected by COVID-19, and probably by the end of the epidemic, we'll all have unfortunately know somebody who's died of COVID-19. So, we'll know that this is a reality, and it's very scary. And I think many people will be very eager to get immunized of COVID-19 because we have personal experience about how dangerous this virus can be. So I think when other vaccines, after they were developed, the disease was still prevalent in the community, like polio, and then there was a vaccine developed, people flocked to get that vaccine because they had personal life experiences of either themselves or a family member that was affected by polio. And so people really respected the dangers of the virus and were very eager to get immunized and very compliant with recommendations. And then generations have passed, and people don't see polio anymore. It's a really rare event, especially in the United States. So people just now don't understand how dangerous polio is, and they just hear a noise about the potential adverse consequences of the polio vaccine. And so they, may want to, think, oh, there's no polio. It's not bad. I'm not going to get immunized. So, that could eventually happen with a COVID-19 vaccine. There could be generations that pass. People might think, oh, we don't have COVID-19 anymore. It's not a serious vaccine. It's not a serious disease. And, there are consequences to the vaccine. I'm just not going to get it. So, that could happen. However, right now that we know that COVID-19 is very contagious, we know that it can be very deadly, especially with people with other underlying conditions and our seniors. And so we're all hopeful that there will be a vaccine developed, and I'm sure many, many people will decide to get immunized to protect themselves and create a herd immunity in our community. So there won't be very much opportunity for the COVID-19 virus to really stick in our community if enough people are immunized. And, we'll have to see what the vaccine recommendations are. We could have a vaccine that's developed that maybe you only need one dose and you're good for the rest of your life. Or maybe you need like 2 doses and you're good for the rest of your life, with 1 dose and maybe 1 booster. Or it could be like flu vaccine, and the virus mutates and we need to get a little different vaccine every year. So I think so those are factors that really play into vaccine acceptability. People, like, their understanding of how dangerous is the virus or the bacteria that they could get immunized against, and what's the effectiveness of the vaccine, what are the safety issues with the vaccine, how likely for them to get infected, or their family members to get infected. And then also, is the schedule for vaccination difficult? Is it something they just need to get like once or twice in their lifetime? Like hepatitis A, you just need to get 2 doses and you're immunized for life. Or is it something like flu where you have to do it every year, and then after a while people think like, oh, I'm sick of it. I didn't get it last year. I don't need to get it this year. So there's vaccines are complicated.
Yeah, I was surprised to read that only 48% of the adult population get a flu vaccine every year. I thought it would be much more. And I was at my doctor's recently, and they talked about people who have a kind of a suspicion that vaccines are more dangerous than you would think, and that's why some people hesitate to get a vaccine. And you kind of addressed it a little bit, but what would you say to somebody who is suspicious of vaccines or who might think that if a vaccine for coronavirus comes out, that, well, it's been rushed and maybe it's not safe because it hasn't been tried enough and I should just wait? I mean, how would you put those fears to rest, or would you?
Well, we know that any vaccine that is licensed in the United States has to go through a litany of scrutiny and has to perform well and shown to be safe in large randomized controlled trials that have been, very scientifically scrutinized, that enroll many people. So hopefully, if there is a rare event, that will be seen in the observations from the study, because there'll be so many people that get the immunization. So we know that that every vaccine so far that is licensed in the United States is very safe and very effective. And we also know that there is a strong anti-vax movement that propagates many false rumors, and they're very loud on the internet. And so if people see something posted, it may not necessarily be true. So we really want to warn people to make sure that they go to a credible source of information. Just because Joe Facebook posted something doesn't mean that it's true. And so what are credible sources of information? Well, you want to go to the scientific literature that's peer reviewed and scrutinized. You want to go to governmental websites that good information, like the Centers for Disease Control and Prevention or the National Institute of Health. You can also go to medical professional organizations, because again, they only post evidence-based information. So I'm a pediatrician, and I know the American Academy of Pediatrics posts a lot of really strong, good evidence-based information for parents, so they'll understand how to better take care of their kids. So I just want to warn if your viewers that just because you saw it on Instagram or Facebook or on a blog doesn't mean it's true. They should really go know your source and really go to sources that provide scientifically based information that we can all use, and then and you read that information, understand it, and then use that information to direct your behavior and your practices.
Now, you had referenced herd immunity, and in Sweden, that's kind of the approach that they took. They didn't really close down a lot of the country, and supposedly their population now has developed more antibodies and might be more protected in the future because they didn't go to a lockdown. Do you have any feelings about that? Any guesses as to which might have been better way to address the situation?
Well, I guess it depends on what approach a country wants to take. So with the Sweden's approach, they made the assumption that they will be able to achieve some type of protective herd immunity. So that assumption means that they believe that the antibodies are protective and they have long duration. But in the United States, we don't feel that we have that good evidence that that is the case, and that with if we have enough people in our community that have antibodies, if we'll ever really be able to achieve herd immunity and protect other people in the community. So there are assumptions there, and so also there's different approaches. So with Sweden's approach, so you can imagine you would see many people infected at the same time. So you would see this big surge of people that were infected, and that a certain portion of the population that are infected are going to become very sick and require hospitalization, and a portion of those people will need to be very sick and need to be in the intensive care unit, and some of those will need to require some type of airway assistance, be on a ventilator. And so the concern is that if this surge of cases gets so high that it'll be beyond our healthcare system's capacity to care for people. That's what happened in Italy, is they didn't have enough hospital beds or intensive care beds or ventilators to take care of all the people that were ill in Italy. And they had to make some really tough decisions and really deny people a hospital bed or an ICU bed or access to a ventilator, where, in another time they would have had access to that. So our strategy in the United States is to, try to smush that curve, keep it low and steady, and hopefully even decrease it, so that we'll be able to stay underneath what our hospital limit is, but underneath what our hospital capacity is. And so everybody who gets sick will be able to get a hospital bed, and everybody who needs an ICU bed will have that, and everybody who needs a ventilator for respiratory support, will get that support. So we're trying to, buy our time. And so this approach gives us time. It gives time for the hospitals to build up their capacity for beds and ICUs and get more ventilators. It gives us time to a vaccine to be developed. And it gives us time for us to acquire more personal protective equipment and be able to, do what minimally we are able to do, safely and protected. So the approach that we're taking in the United States is in keeping the numbers suppressed as low as possible to buy us time to get the healthcare resources that we need.
We're almost out of time. One last question, briefly. How is the status of testing going in Erie County?
So we have two different types of tests available in our county. One is a diagnostic test. So that type of test, it will tell you at the point of time when you had your specimen collection, did you have an infection, an active infection? And that's the swab test. It's a test where people have a swab placed, either they place it themselves or a nurse or a licensed provider will place the swab like way back deep in your nose, and it's run with a test called a PCR test, a polymerase chain reaction test, and that's testing for DNA or RNA of the COVID-19 virus. And so if your test is positive for that, it means at the time when you had the specimen collection, you had COVID-19 DNA or RNA in your respiratory tract and you were infected and shedding virus and probably contagious to other people. Whereas the antibody test will tell you that you've been exposed to COVID-19, you're probably infected at one point, and your body mounted an antibody response to this virus. And that's what the test is detecting, is the antibody levels. So that's right now, that's available in a blood test. So it's, you have to, put your arm out and have your blood taken with, with a needle and syringe. And then that will, tell you if you've had COVID-19 in the past. We don't recommend that people get that test if they're currently have symptoms. If people have symptoms, they wait at least 21 days after the beginning of the symptoms to make sure that they have a good antibody response and that their test is valid. And then people will say, well, if I have antibodies and I am protected against a future infection, does that mean I'm immune? We're hoping that's the case. However, we don't really have enough experience, or we don't have enough data to really say firmly that antibodies are fully protective. And then also, if we do find that they do offer some protection, we don't know how long that protection can last. I mean, there are, some, viruses and some bacteria where you can get sick once and then you'll never get sick again. And then there are some bacteria and viruses where you get sick once and you get sick again, that same year or next year. So for example, we've all had a strep throat more than once, right? And unfortunately, some people have fallen ill with influenza more than once. So, sometimes antibodies can be protective and sometimes they're not protective. So we'll have to wait to see what happens with our experience with COVID-19. And we know that there are some medical studies going on right now following people that have had COVID-19 and see if they develop any type of reinfection.
Well,
so time
certainly,
will tell.
Yep, a work in progress. Certainly, Dr. Gale Burstein, thank you very much. It's a pleasure to talk to you, and we're going to have to do this again as time goes on. It's very informational and educational talking to you about this. Thanks for being my guest on the Big Picture. And I want to thank everybody for watching The Big Picture, and I want to thank everybody for watching WBBZ-TV. And we're out of time now. We'll see you next time on The Big Picture.